Hey everyone, I just wanted to touch base on this week's assignments and your module. You are on module 3 this week, Health Risk Appraisal. This module is really important because everything we will do from here on through the rest of the semester is based off of what your patient or your client tells you within this health risk appraisal. So we're going to learn all about their medical history, any disease states they have been diagnosed with, any risk factors for disease, signs and symptoms of disease, specifically cardiorespiratory disease, and what that means for exercise prescription. The punchline here with this module is that once we know what their risk is for having an adverse event during physical activity, we can then determine if they need physician clearance before exercising at low, moderate, or vigorous intensity. So as you read through, it's going to be really important to read this chapter in your book, and so I wanted to just pull it up here and kind of show you some really important parts to pay attention to. We discussed the PAR-Q in your reading and in your slides. It's these 7 questions here. Has your doctor ever said that you have a heart condition or high blood pressure? Do you feel pain in your chest at rest during daily activities of living or when you do physical activity? Do you lose balance because of dizziness? Have you ever lost consciousness in the last 12 months? So fainting, dizziness. Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure? Are you currently taking prescribed medications for a chronic medical condition? Do you have a bone or joint problem that could be made worse by becoming more physically active? And then number 7, has your doctor ever said that you should only do medically supervised physical activity? So if the answer to all of these questions is no, they are generally cleared to exercise at moderate to vigorous intensity without physician clearance. If they answered yes to any of these questions, they will also need to fill out the health screening questionnaire, which is the next form. Health screening questionnaire is sometimes also called a health risk assessment, or HRA, or as you can see here, your book calls it a health status questionnaire. Those terms are all used interchangeably. It asks for general contact information, height and weight, so we can determine BMI, emergency contact, and then as you'll read through and you pay attention to that Mr. Please acronym, that is really important for y'all to understand that order in which we are gathering this information, determining their level of supervision that they need, their level of physician clearance that they might need to exercise at what intensity, and then we will assess their current state of physical fitness, prescribe, and evaluate. So this is that really important first step. We need to know if they are already participating in physical activity or if they are not regular exercisers, because that makes a difference in how you will pursue physician clearance for them. And then it's going to ask about medical conditions and then symptoms of medical conditions. Sometimes individuals will have medical conditions and not know it, but if we can identify those symptoms, we can hopefully identify some of those things that might be put them at risk. And then prescribe medications, of course, for those conditions that they may or may not have. Now, once you know if they are a regular exerciser, we've got our signs and symptoms here. It's good to look through those. Really important that y'all are reading this chapter this week. Your slides highlight these 2 tables. So this first one is for subjects who do not already exercise. So if they are sedentary, they do not already exercise, and they have no disease, have not been diagnosed with any cardiovascular disease, metabolic disease, no signs or symptoms of disease, then they can go ahead and be cleared for physical activity. But if they do not exercise and they do have known issues, you need to get medical clearance before they start exercising at all. If they don't know, they haven't been diagnosed, they're not already taking medications for one of these conditions, but they do have sign or symptoms of it, you also want to get medical clearance before they start exercising. Now, for those who already exercise regularly, if they have no metabolic, cardiovascular, any disease, and no signs or symptoms, they are free to go ahead all the way up to vigorous intensity exercise if they are already exercising regularly. Also, if they are regular exercisers who know they have been diagnosed, they are taking medications for, they are in treatment for one of these conditions, they can continue exercising, but before you prescribe vigorous intensity exercise, you're going to want to make sure it's okay with their physician. Now, if they are already exercising, they don't have known cardiovascular disease, metabolic disease, or renal disease, but they develop a sign or symptom of one of these, you want them to stop exercising, then get medical clearance from their physician, and then they can resume after clearance. So those are some of the really important high notes from this week. I hope you pay really close attention as you're reading through the chapter. You've also got quiz 1 this week, and it covers modules 1 through 3. So everything we've talked about so far will be included in your quiz this week. Hope y'all have a great week. Remember that you can always contact me, make an appointment for my office hours. We can meet one-on-one via Zoom, and I'm always happy to chat with you, fill you in on anything you feel like you need further clarification on. So please reach out. Don't hesitate if you need to get in contact with me. Hope y'all have a great week.